I'm absolutely thrilled to have been offered the chance to be president of the association. These are people doing the most important work right at the forefront of what everybody's talking about, the need for more preventative, more community medicine. Health visitors, everybody loves health visitors. Everybody remembers when they first have a baby how wonderful, reassuring and brilliant health visitors are. Desperate shortage of them, although there are more than there were, and that's one good thing the government's done. I've been hearing about the enormous caseloads they have and the very hard job they have, and I hope that I can be in a position to promote the good that they do, to carry a flag for them, and to remind people just how valuable they are. We need to go on and on recruiting more and more health visitors. Some of them, I've been talking to today, have got caseloads of 850. They can't possibly get to know those people. Others of them are being made to work in a way where they no longer have a personalised caseload, so they don't have a personal communication with a family, and that seems to be quite the wrong way to go. I think we have to look back at a time when people knew their health visitors and their health visitors had a manageable caseload. So I hope that we can go on recruiting more. Also, a lot of health visitors are leaving, moving on to other things. We need to constantly train up and replace those people. Well, health inequalities are only the outcome of a society that's growing more and more unequal, has done for the last 3 decades. We were at our most equal at the end of the 1970s. Since then, particularly accelerating in the 80s, these huge social divides, and we're really reaping the effects of that, and you can see it all over the country. Really deprived communities with no chance to get onto their feet. Children who, right from the moment of their birth or before, are destined to do less well because of the poverty of the situation in which they find themselves. And in a sense, health is just there trying to patch up the effect of that. The fundamental causes are poverty itself, inequality itself, and it's left to the health professionals to cope as best they can. There's a great danger that school nurses are disappearing down the cracks of the new health system, and that nobody is really taking responsibility for making sure that every school has a school nurse. They are the escape valve for children in trouble who may not want to talk to teachers but can talk to somebody outside the school system about whatever problems that they have. It's absolutely essential that children have an access to that element of the health service. Increasingly we're finding people not commissioning school nurses, not knowing really who's responsible, and we've got to make sure we make the case for why every child needs access to a good school nurse.
Thank you very much.